Welcome back, fellow mitochondriacs, for another episode of Cancer is a Mitochondrial Metabolic Disease. We have been working the last couple of weeks about on strategies how to lower your blood glucose, your A1C, which ultimately will affect your glucose ketone index. And just to reiterate, in order for the other pieces of the metabolic therapy synergy to actually happen, we need to have your blood glucose at a pretty darn low level. And we got to get your GKI down near 1 for other parts of the therapy to work effectively. And so you don't waste your time and money. So that's why I'm spending so much time on talking about things that can lower blood glucose, because blood glucose issues are an issue for a lot of people, but it's especially difficult in a setting like this because we have a very defined target, and it makes it very difficult for people who have any problems with blood sugar. So I want to give you as many tools in your tool bag as possible to employ these things. And we've been on a really interesting journey talking about phytonutrients in this case, that have the ability to lower blood glucose on average. And we've been talking a lot about a test called a hemoglobin A1C. And when I look at these studies, I look specifically for studies that have that information, because it is going to tell us what your average blood glucose is going to be. And what I realized when I was putting the necessary information together for this particular video is that I never really had a chance to lay down the groundwork of what A1C actually is and why we look at it. So I'm going to lay some ground today because I think it's important. So there is a concept or a pathophysiologic state called advanced glycation end products, or AGEs. And essentially what happens, one of the big reasons why having blood sugar that's high is a problem, okay, apart from the insulin side of things, okay, but by itself, is that there is a process called glycation that can happen, okay? And what happens is that these sugar molecules that are in excess will, through non-enzymatic processes, or basically not requiring any special machinery, protein machinery, attach themselves to various molecules in your blood vessels, okay? And those could be proteins, those could be other carbohydrates, and that process is, or lipids, and that process is called glycation. And glycation damages those proteins from working correctly. And so it causes dysfunction in and of itself. And one of the ways that we in medicine can know how good your glycemic control is something called a hemoglobin A1C. And a hemoglobin A1C is, we have red blood cells, right, that are circulating throughout our blood system. And then inside of those blood cells, we have a molecule called hemoglobin, and that's what's carrying our oxygen around in our system and donating it where it needs to go so that we can complete the process of respiration at the cellular level. And so what happens is glucose will glycosylate or glycate this hemoglobin molecule, and that is how we know whether or not you have poor glycemic control, because when you have excess amounts of glycation of the hemoglobin molecule, that's how the hemoglobin gets damaged, and we can detect that in the bloodstream. So basically, we have, again, hemoglobin plus glucose equals A1C ultimately, okay? And the life of a red blood cell is somewhere around 120 days. So essentially what that gives us is, it gives us essentially the amount of glucose control over a 3-month period, about 3 to 4 month period. And So for example, if I go to Quest this morning and I just got off work last night and I'm stressed and now I'm gonna like go have someone stick a needle in my body and I'm under blue light and my cortisol's through the roof, that will have an effect on my blood glucose. It'll be higher in that kind of stress situation than it would be if I was getting my blood drawn when I was completely relaxed and in the dark or under red light. So our environment has a lot to do with the fasting blood glucose or even like a random blood glucose. But the A1C is going to be much more like have a much more like good picture of what is actually happening on average. Okay. And they have these pretty cool calculators of, an average blood glucose, or excuse me, the A1C, and then an estimated blood glucose in both milligrams per deciliter and millimoles per liter. So, for example, it is considered normal, okay, to have a hemoglobin A1C of less than 5.7%. I argue and say you want it to be as low as possible, but I'll digress. This is conventional medicine's way of looking at A1C. If you're in 5.7 to 6.4%, okay, that's like the danger zone. You're at pre-diabetes, and then above 6.4% and above is considered diabetes. And then the higher the number, the worse it is. And you can see here that in general, if you have a hemoglobin A1C of less than 5.7%, you're going to have an average blood glucose of less than 117 milligrams per deciliter, which is not fantastic, I'll be honest with you, but it's considered normal. And then let's say hypothetically you have a hemoglobin A1C of 8.5%, 197, or 9% at 212, right? So even though this is helpful for our purposes, I found this graph to be even more effective, okay? So it goes all the way to 4%, and it goes all the way to 13.9%. Now, have I seen people in a hospital that have A1Cs of greater than 15%? Yes, absolutely. It means their average blood glucose is well above probably 400. Really bad. However, if you're at quote unquote normal and you're at 5.7, are you where you want to be? Okay. Are you good, quote unquote? No, likely not. And the reason is because when it comes to metabolic therapy, we want your average blood glucose to be less than 80. Okay, 80. So does that mean you need to have an A1C of 4.4? Maybe, maybe. Well, you have to check your glucose regularly and your glucose ketone index regularly. But it may mean that in order for you to have the maximum success on metabolic therapy, you may need to have an A1C around 4.4%. So when you get your doctor to get your A1C and it's 5.5 or 5.4%, but you have cancer and you want to employ metabolic therapies, don't write this off and be like, oh, I'm good for my A1C. No, like that's why you're not able to hit the targets, because on average, you're not hitting the targets. Does that make sense? So I wanted to teach that first and foremost, because we're talking a lot about A1C, and that's the data that I try to pull from the papers, because it's going to give us a better picture of your glycemic control on these particular interventions, whether it be cinnamon, whether it be berberine, whether it be whatever. Hello from Canada. Hope you're staying warm up there. And Vero Beach, you're staying definitely warm down here. Although it's kind of a gray day down here, it's kind of trying to rain down here in Miami. Okay, moving on. So I want to hit first berberine. So berberine is one of the compounds that classically lay people know about as something they can use to lower blood glucose. And, this paper is titled Research Progress on the Pharmacological Effects of Berberine Targeting Mitochondria, and it was published in 2022. And it says here that this paper summarizes the molecular mechanisms of the quality control system and briefly reviews the targets of berberine in regulating mitochondrial activity. It is proposed that berberine mainly regulates glycolipid metabolism by regulating mitochondrial respiratory chain function, promotes tumor cell apoptosis by regulating mitochondrial apoptosis pathway, and protects cardiac function by promoting mitophagy to alleviate mitochondrial dysfunction. So, although I would love to talk about only glucose today and how it affects our success with metabolic therapy, when I saw this paper, I had to pull it because it had a great graphic, and it's talking about mitochondria, which is a big part of the problem when it comes to cancer and a lot of other diseases as well. So berberine, when used in a way, I'm gonna back up for a second. When used for preventive medicine, okay, it's going to have a lot of effects that are really good for us. All right. So one of the things that it's going to be able to do is it's going to be able to have influence over some of the sirtuins, like SIRT1. And SIRT1, when it's shut down, is actually a way that we can enhance pseudohypoxia. And so this is one of the mechanisms of how calorie restriction works or fasting works, is through SIRT1. And SIRT1 has effects on blocking hypoxia factors. What I'll also say, it has a positive effect on PGC1 alpha, which is, let me see if it doesn't actually say it here in this graph, but PGC1 alpha is the main stimulator of mitochondrial biogenesis, okay, the making of new mitochondria. It also has effects on other sirtuin systems, PINK, Parkin, FOXO, PIK3, AKT. And it's interesting because a lot of these pathways within a cancer model, okay, particularly HIF1 alpha and PIK3, AKT, are seen to be pro-cancer, okay? And it's just fascinating that in a normal cell where it needs to be activated, it is activated for a particular purpose. So for example, SIRT3 is blocked, which blocks complex 1 and inhibits mitochondrial oxidative phosphorylation, which ultimately affects the AMP ATP ratio, which stimulates AMPK, which can get us a backdoor into PGC1 alpha and mitochondrial biogenesis. It can also affect PINK Parkin, which is important for promoting mitophagy, as well as some of these other signaling cascades, which can help mediate apoptosis or programmed cell death. So berberine, as we've seen in other videos where it has effects on several glutamine pathways, it also has effects on mitochondrial health as a whole. And I just wanted to share that first because obviously we're talking about cancers and mitochondrial metabolic disease, and prevention is way better than dealing with a diagnosis after the fact. So the first paper I want to talk about with berberine is titled Therapeutic Effects of Berberine on Metabolic Diseases, both pharmacological data and clinical evidence, and it's published in 2021. And it says here that in recent years, berberine has received widespread attention due to its good potential in treatment of metabolic diseases. In order to promote the basic research and clinical application of berberine, this review provides a timely and comprehensive summary of the pharmacological and clinical evidence of berberine in the treatment of 5 metabolic diseases: type 2 diabetes mellitus, obesity, non-alcoholic fatty liver disease, hyperlipidemia, and gout. Both animal and clinical studies have promoted or proved that berberine has good therapeutic effects of these 5 metabolic diseases. For example, it can promote insulin secretion, improve insulin resistance, inhibit lipogenesis, alleviate adipose tissue fibrosis, reduce hepatic steatosis or fatty liver, and improve gut microbiota disorders. Collectively, berberine may be a good and promising drug candidate for the treatment of metabolic diseases. So it's a pretty glowing review according to this particular paper that was published in 2021. And I just want to say that, again, this paper is talking about metabolic syndrome and all of its consequences as a whole. So it's talking about obesity and non-alcoholic fatty liver disease and hyperlipidemia and gout, as it says in the abstract. But we're in particular going to be talking about its effects on blood sugar dysregulation. And I have went through the paper and I've highlighted key points that it was able to talk about. So number one, berberine can help promote insulin secretion. So one of the issues is that in people who have diabetes and insulin resistance, prediabetes, et cetera, is that the pancreas and the beta cells kind of burn out. And so a lot of these substances, if you remember back from the last couple of talks, is that when they talk about mechanisms, is that they believe that the beta cells essentially of the pancreas, the cells that are responsible for releasing insulin are actually regenerated and or protected from oxidative stress, inflammation, etc. So that helps allow them to release more insulin than they were able to when they were in kind of a damaged state. So it's not that we're trying to raise our insulin levels. That's not the case at all. But we do need insulin in a lot of cases in order to get rid of the blood sugar out of the system. So if you're not able to produce insulin at all, the blood sugar is going to remain high, which is why people become insulin resistant, or excuse me, they become insulin dependent, right? So now there's not enough insulin that's being produced by the system to get the blood sugar out of the bloodstream. So therefore we have to inject endogenous insulins into a patient in order to get the blood sugar down, right? So what we're doing is we're trying to regenerate the system, and berberine does to some degree do that. Now, berberine actually alleviates insulin resistance through multiple mechanisms as well. So it says here that berberine can reduce insulin resistance through protein kinase C dependent upregulation of the insulin receptor expression. So it can actually upregulate the actual receptors of insulin. So there's more of them available. So insulin can unlock the cell to open up and bring the glucose in. Later on, it says that berberine attenuated insulin resistance through elevating the activity of AMPK, a chemical messenger system that we've talked about dozens of times on this particular channel. And in these 3T3 L1 adipocytes and L3 myotubules, increasing the transport of glucose transporter type 4 or GLUT4. So one of the benefits of activating AMPK, one of the many benefits, is that it will actually upregulate these GLUT4 transporters and allow more sugar or more blood sugar to get into the cells and get it out of the bloodstream where it's wreaking havoc and raising insulin further. Berberine inhibits gluconeogenesis, the inhibition of hepatic gluconeogenesis, or the creation of blood glucose. So when your blood glucose is low, okay, or the second way that this would potentially happen is when you're under stress, okay, or if you have insulin resistance and they can't detect that the blood sugar is actually high, your body will pump out extra glucose into the bloodstream, making things even worse through a process called gluconeogenesis, where you actually take other chemical molecules and turn it into glucose and then release into the bloodstream. Now, if you're hypoglycemic, if your blood sugar is low, then it's actually life-saving, right? That's how glucagon works. But in the inhibition of hepatic gluconeogenesis plays an important role in the treatment of diabetes. And this enzyme, this PEPCK and glucose 6-phosphatase, are key enzymes in the gluconeogenesis pathways that are inhibited by berberine. So berberine also inhibits, promotes glucose uptake and glycolysis. So considerable evidence has proved that berberine increased glucose uptake in the absence of insulin and enhanced glucose metabolism via glycolysis in these adipocytes and myotubules and hepatocytes. Berberine stimulated glucose uptake independent of insulin action in these L6 myotubules by activating AMPK. Again, AMPK has multiple downstream effects, and you'll see it mentioned throughout this entire kind of paper itself of all the different actions that are being undertaken because of AMPK. Berberine inhibits inflammation. Existing data indicate that inflammation has the potential role in the pathogenesis or the creation of diabetes. Some inflammatory factors are involved in development of insulin resistance, such as tumor necrosis factor alpha, TNF alpha, IL-6 or interleukin 6, and IL-1, and reactive oxygen species. Therefore, inhibiting inflammation is beneficial to improved type 2 diabetes mellitus. Berberine shows obvious anti-inflammatory activity in vitro and in vivo. So when I was very new to functional medicine, one of my mentors coined the term the 4 horsemen. And the 4 horsemen were as follows. It was insulin resistance, oxidative stress, chronic low-level inflammation, and catabolic physiology. And all 4 of those are specific ways that the system is broken, but they all influence each other. So if you have catabolic physiology, which ultimately means an elevation, chronic elevations in cortisol, okay, that can by itself create reactive oxygen species. That by itself will raise glucose chronically and lead to insulin resistance. And then that inflammation that happens when you gain weight will increase inflammation, reactive oxygen species, and become a variety of vicious cycles. That's why obesity, insulin resistance, and diabetes is so detrimental to the human body and human organism and causes so much disease. So the fact that, again, it's not like its main function, as you can see, there's multiple other functions of how the blood glucose is lowered with berberine. But one of the ways it does it is by lowering these inflammatory markers, these inflammatory cytokines and reactive oxygen species. Berberine inhibits key enzymes. Okay, these key enzymes are located in the gut lumen. Okay, in the actual small intestine, such as alpha glucosidase, dipeptidylpeptidase 4, DDP4, the protein kinase phosphatase 1b inhibitors are potential candidates for the treatment of type 2 diabetes mellitus. Alpha glucosidase is an intestinal enzyme that can break down carbohydrates into monosaccharides. And this particular group found that berberine effectively reduced intestinal glucose absorption by inhibiting the activity of alpha glucosidase. I'm going to make the point that I want to make, and I've been making with berberine in particular after I talk about the next mechanism of action. Berberine improves gut microbiota dysbiosis. So gut microbiota, or bacteria, is involved in the etiology or the cause or the progression of metabolic diseases, including diabetes and obesity. Therefore, the regulation of gut microflora or microbiota can be a novel treatment strategy for diabetes and its complications. It's been demonstrated that berberine fumarate showed a hypoglycemic effect by regulating the gut microbiota and metabolism of these diabetic. Basically, they use a particular chemical to induce diabetes in these rats. Specifically, berberine fumarate remarkably increased the number of Bacteroides, as well as, I'm probably going to butcher this one, Proveticiella, Clostridia, Lactobacillus, and Alloprovella, but decreased those of Bacteroides, Rickensiella, Lachinspiraceae, Des sulfurvibrio. These are all different parts of our intestinal microbiome. And when they had that effect on the intestinal microbiome bacteria, it showed similar berberine reduced plasma glucose levels regulated by the competition of the gut microbiome, reduced intestinal inflammation, and repaired the intestinal barrier in these particular mice. And then berberine enriched the population of short-chain fatty acid-producing bacteria, Butyronosomonas, Coprococcus, and Ruminococcus, reduced some opportunistic pathogens, Provotella and Proteus, and increased several probiotics such as Lactobacillus and Akkermansia. So now I want to make my point. After talking about 3.16 and 3.17, talking about inhibiting gastrointestinal enzymes that break down glucose so they can't be absorbed, or changing the gut microflora as a way of lowering inflammation and lowering blood glucose and producing short-chain fatty acids, then it always comes down to, is berberine better than dihydroberberine? Or what happens if berberine is not absorbed? Am I still going to get the effect that I'm looking for? Well, I would say it depends on your goal. If you're using berberine as a way to, let's say, block glutamine uptake from SLC1A5 or some other part of the glutamine system, or you want to have effects on other key enzymes inside the actual body, okay, then absorption matters big time, okay? Because if it doesn't get to where it's going to go, it's not going to have its effects. If you're using berberine because your blood glucose is out of control, or you can't get that critical 80 milligrams per deciliter goal when you're trying to employ metabolic therapies on average, then it doesn't matter, because part of the beauty of how some of these phytochemicals work is that it affects the things that are in the actual intestine, have nothing to do with being in the blood, and it affects the gut microbiome. So in fact, I could dare say that there's actually a huge benefit of it not being absorbed within the particular context that you're trying to use it for, right? And only you're going to know what you're using it for. So that's a discussion between, kind of like your situation, your N equals 1, and you and your doctor. Talking about molecular mechanisms of how berberine actually works, I thought this graphic was pretty cool. So it has effects on lowering specific inflammatory mediators, such as nuclear factor kappa beta or NF kappa B, which is going to ultimately lower downstream continuation of production of inflammatory cytokines, such as the IL-6, such as the TNF alpha, such as the IL-1 beta. Very important pro-inflammatory cytokines. It's going to have effects on MAPK. It's going to have at various levels. It's going to have major effects on the AMPK system, as we've talked about kind of throughout this. And that's going to have important effects on the NRF2 pathway. It's going to have important effects on the PGC1 alpha pathway, as well as upregulating glucose transporters so that more glucose is available. It's going to have effects on ATP-AMP ratios for mitochondria. It's going to have important effects on stimulating insulin secretion and improving insulin receptors on the actual cell membrane. It's going to have effects with GLP-1, similar to Ozempic. The GLP-1 is going to increase it. So, berberine is a rock star when it comes to blood glucose. And I think intuitively people know that's the case, which is why, in general, lay people know about its effects on blood glucose. This paper was titled A Descriptive Review of the Mechanism of Action of Berberine, Quercetin, Similarin in Insulin Resistance, Hyperinsulinemia, and Cardiovascular Prevention. And it says here that among the most interesting and well-known natural remedies, alkaloid berberine and the flavonoid quercetin have particular relevance in the literature, while Similarin, the active principle of Silybum marianum thistle, or milk thistle, was traditionally used for lipid metabolism disorders to sustain liver function. Now, this paper was published in 2023, so it's pretty relevant, pretty new, right? But what I'll say is that although berberine, specifically quercetin to some degree, is more seen to be helping a variety of conditions, including diabetes, hyperglycemia, etc., and milk thistle and Similarin were not. It's interesting because in the next video, I'm going to go over Similarin and its effects on A1C, and I was particularly shocked of how effective it was. Anyway, I'll digress. The review describes the major defects of insulin signaling leading to insulin resistance and the main properties of the three mentioned natural substances, their molecular targets, and synergistic action mechanisms. The actions of berberine, quercetin, and Similarin are particularly superimposable as remedies against reactive oxygen species intermediates generated by high lipid diet and by NADPH oxidase, which is triggered by phagocyte activation. Furthermore, these compounds inhibit secretion of a battery of pro-inflammatory cytokines, modulate intestinal microbiota, and are especially able to control the various disorders of insulin receptor and post-receptor signaling pathways. Okay, that was a lot of mumbo jumbo that I want to go over because it all contributes to this metabolic syndrome and insulin resistance. So I'm not going to deep dive into this graphic, but it's a really interesting graphic that was published in this paper because it just shows the connection between insulin resistance, hyperinsulinemia, high blood glucose, right, and diabetes, and systemic inflammation, and obesity, and hypertension, hardening of the arteries, major ischemic events such as heart attacks and strokes, as well as heart failure. So this plays a central role in the way our body is broken down. And I don't know if they are still saying this and teaching this in medical school. But when I was in medical school, what I learned was if you have diabetes, that's equivalent to having a heart attack in the past in terms of like a personal history, right? So that's how intimately involved insulin resistance, diabetes, is with atherosclerosis at least, and hardening of the arteries, or you know basically coronary artery or peripheral arterial disease, which is where you'll see blockages in the the cerebral, excuse me, the carotids, the vertebral basilar system, the peripheral arterioles, as well as the coronaries. When you look at various studies that we use in medicine to look at those, this is at a big part of that process. So even if you don't have cancer and you have diabetes, just know that this has got to be like very high on your priority list as a way to help yourself. All right, going down. So basically, this is looking at very similar mechanisms of what we've seen in the past of how berberine, in particular, as well as the other, quercetin and simularin, have effects on a variety of systems. And it's best characterized by looking at what is actually written and what I've highlighted in the papers here. So effects of berberine on glucose metabolism. Berberine has been used for many years in China as an oral hypoglycemic in the treatment of diabetes mellitus type 2, and its effects on blood glucose metabolism are sufficiently well known. Its hypoglycemic action has been verified in subjects with type 2 diabetes and compared to that of metformin in randomized study. So you're going to hear metformin referred to throughout this talk today in particular. And I have some information at the end of this talk that helps give some perspective on how effective is metformin at lowering blood glucose and lowering A1C. So when they say it's comparable to that of metformin, what does that actually mean? Moreover, in the same study, it says down later, it says, moreover, in the same study, a group of 48 patients with poorly controlled diabetes received berberine supplements for 3 months, and their glycolated hemoglobin levels decreased from 8.1 to 7.3. That's a huge drop. It's a 0.8 drop, 0.8% drop, with the HOMA IR significantly is improving as well. So it's not immediate, but it is powerful that 3 months of berberine lowered this, in this particular study, the A1C by 0.8%. Several basic studies have investigated how berberine exerts its positive effects on glucose metabolism and insulin sensitivity. Berberine also increases insulin sensitivity because it increases insulin receptor gene expression. We talked about that in a dose and time-dependent manner. By increasing receptors, berberine improves glucose consumption in the presence of insulin. Later, it says they found that berberine stimulated AMPK, something we've talked about, an enzyme protein that plays a major role in regulating the whole body energy homeostasis. Indeed, the administration of berberine in this mouse model resulted in significant reduction of their weight associated with significant reduction in fasting glucose with improvements in glucose tolerance. Later, it says, subsequently, it was reported that berberine increases glucose uptake in 3T3L1 pre-adipocytes by increasing the expression of GLUT1 gene, unlike insulin, which acts by promoting expression of GLUT4 on the cell surface by activating PIK3. These effects of berberine were found to be mediated also through AMPK, resulting in an improvement in energy production and reduction of energy storage. And it says later, in addition to PPAR gamma, berberine alone, or in synergy with other phytocompounds, has many other molecular targets that regulate glycidic metabolism. Furthermore, insulin tolerance studies showed a clear improvement in insulin resistance status, and it was observed that berberine acutely reduced via the AMPK signaling pathways glucose-stimulated insulin secretion by pancreatic beta cells in rats. So again, berberine is a rock star. And I pulled this paper just because I wanted this graphic, if you want me to be honest with you. This graphic was pretty cool. And it says here that based on previous research, berberine significantly reduced levels of fasting blood glucose, hemoglobin A1C, inflammatory cytokines, and oxidative stress markers. Furthermore, berberine stimulated insulin secretion and improved insulin resistance through different pathways, including upregulation of protein expression of PPAR gamma, glucose transporters GLUT4, PIK3 AKT, AMPK activation. Interestingly, it was demonstrated that berberine protected against diabetes complications as well, such as diabetic-induced hepatic damage, non-alcoholic fatty liver disease, cardiovascular disorders, nephropathy, or kidney-related damage from diabetes, which is one of the most common causes of chronic kidney disease in the United States, and neuropathy, diabetic neuropathy. And I thought this was cool because this is a more recent paper, 2023, and it shows that berberine is activating AMPK, SIRT1, this P38, PIK3 as a way to ultimately have improvements of reactive oxygen species management through the NRF2 pathways, decreasing, as you can see, inhibit, all these pathways that can lead to upregulation of NF-kappa B, which is going to have an anti-inflammatory response. And I just want to mention here that I can't personally explain it, but maybe someone can, or maybe only God can, because basically it has effects on some of these things like PIK, AKT pathways, which are actually kind of pro-growth pathways, which end within cancer models. But it seems that a lot of these phytochemicals, like sulforaphane or like berberine or like curcumin, they have effects that impact the system positively no matter where it's at, right? So if you need help with insulin signaling and lowering blood glucose, it's going to stimulate those pathways. But then within cancer, because these pathways are like constitutively activated and they're always on and they're kind of like creating the vicious cycles of cancer growth, uncontrolled growth, it seems to block these pathways within cancer models. It's very fascinating. We've seen the same thing with vitamin D and with melatonin and several other compounds. So when we actually look at how does berberine actually do clinically, okay, I'm going to pull some studies here. So one was a study in 2010. It says berberine lowers blood glucose in type 2 diabetes mellitus through increasing insulin receptor expression. And in this clinical study, berberine significantly lowered fasting blood glucose, A1C, triglycerides, insulin levels in patients with type 2 diabetes mellitus. The fasting blood glucose and A1C lowering effects of berberine were similar to that of metformin or this rosiglitazone, which is a medication that actually inhibits PPAR gamma. And it doesn't actually tell you what the A1C was for that particular study and what the lowering effects was, but in this particular study, it did. So this paper was is published in 2019, Effects of Berberine on Blood Glucose in Patients with Type 2 Diabetes Mellitus, a systemic literature review and meta-analysis. And it found here that the pooled data showed that berberine treatment was associated with better reduction in fasting blood glucose and A1C. And it lowered, in this particular meta-analysis, A1C by 0.54%. And which I think is pretty fascinating, because the other paper we saw, where was it? Back up here. It may have been down here. It showed a 0.8% in this particular trial. So somewhere but like the 0.5 to 0.8% is what I'm seeing. And then this is a newer meta-analysis in 2024, February, and it showed that the A1C reduction was somewhere in the 0.57% model. So somewhere between 0.5 and 0.8% is what we're seeing. Although these are going to be like an average, right, of the averages of 0.57%. Now, what does that actually mean in terms of a blood glucose reduction? So we're looking at, let's say, nearly a 0.6%, let's say. So from 229, I picked a random value, 9.6%, 229 down to 214. So about a 15 to 16, 17 point reduction on average of your blood glucose. Now, that may not be a big deal, may be a huge deal if you have a really bad A1C, like at 9.6%. But let's say you're at, I don't know, let's say you're at 5.2%, and now you're lowering down 15 points down to, 85 or something like that. We're so much now closer to that goal of 80, on average. So something like this could make the difference for the right person. Do I believe it should be used as a standalone? Like these papers are looking at berberine as a standalone fashion, right? Not berberine plus exercise, not berberine plus sun exposure, not berberine plus red light therapy, not berberine plus anything else, right? It's just berberine by itself, and it has profound effects. So, the smart person would be using berberine in addition to other phytochemicals, in addition to a ketogenic diet, in addition to fasting, in addition to, exercise and, light management. But the fact that the matter is, it's pretty amazing that one chemical by itself can have effects such as this. And I would just say that, again, it seems to have effects similar to that of metformin. And, berberine has unbelievable effects within the cancer model. We talked about it quite a bit during the series on glutamine, and it has a lot of effects there. And although there's a lot of overlapping effects of berberine and metformin, what I would say is that within cancer in particular, I do believe they do have a lot of overlap, but they also have a lot of distinct benefits. So therefore, using them in combination, if it's right for you, between you and your doctor, could be beneficial. Before I move on to the next chemical, let me see if I can look at the comments and see what we got here. So good morning to you. Hello from Germany. Hello from Florida. You should be part of the MAHA team. Yeah, I don't know. I mean, Dr. Cruz is already, I think, going to be part of that team, and I think he's going to bring a lot more experience and knowledge to the team. But I mean, if they ask me, I would love to be part of a MAHA team. Fancy words for a horseman. Yeah, that was Dr. Dan Kalish who taught me that. I did a great 1-year fellowship in functional medicine with him, and I had a great experience. Low dose or high dose of berberine that lowers glucose. Well, the dosages are, like in most cases, okay, guys, on here, I don't talk about dosages because I don't want to practice medicine on YouTube. But what I would say is that the dosages of berberine are pretty well established. And in general, most people are doing like 500 milligrams 2 to 3 times per day is what the general dosing is. Doesn't mean it's right for you. That's a discussion between you and your doctor. But 500 3 times per day seems to be a pretty standard dose. You'd have to really dig into these meta-analyses, to be honest with you, and to the actual look at every possible study that they looked at, in these studies, in these meta-analyses of the studies that they used for those particular analyses, and you would see that they would give the amount of berberine they use in every study. And I didn't do that, but I think it would be useful to do that to see if some of the how do I want to say it? If some of the weight that was given to studies, if they were, we saw that one paper, for example, we saw it lowered A1C by 0.8%, which is a great number, right? That's amazing. We would love to see everybody's A1C go down by 0.8% or more by using berberine. But was the reason why the average of berberine is 0.57% or 0.54% because they're using studies where they used underdosed amounts of berberine? They're not really looking apples to apples. I mean, I would want to believe that they're looking at that and trying to make them homogenous across the board, but I don't know for a fact. We have to look into the methods a lot more. Furniture start floating. Add berberine to the combo. Adding berberine to the combo. Uracilin A is a metabolite produced by the gut bacteria, specifically in certain strains within microbiome. When they metabolize ellagic acid. Yep, that's right. That's right. Yep, pomegranates. Yep, big in pomegranates. Pomegranates probably one of my favorite foods of all time. Uracilin A compound improves mitochondrial health, inducing mitophagy. Yes, it does. Yes, it does. This is like a whole book on uracilin A. Yeah, we'll talk about uracilin A. It's not like a big on my list of things to talk about for cancer in particular, just because I haven't seen a lot of literature to show how it helps where I want it to help. In particular, glucose lowering and glycolysis effects or glutamine effects. But I think uracilin A for preventive medicine could be very, very important. And I do think that the things that it does, are particularly important for help improving mitochondrial heteroplasmy. Difference between berberine and dihydroberberine: should we stack or use with metformin, berberine, and dihydroberberine, or use them alternatively? Well, like I said, I can't practice medicine on YouTube as much as I would like to, and I can't give you information about that. Okay, what I would say is that dihydroberberine is generally what's converted to absorb, so it's the more absorbable form. But are you missing out on the effects on the small intestine and the colon by doing dihydroberberine? And my gut says, pun intended, yes, you probably are missing out on those things. So therefore, could you get a benefit of using dihydro plus berberine together? And my gut says that you probably could. Again, how is it affecting your GKI within the cancer model, or your blood glucose, or your A1C? It's always important to test, right? Because it's unlikely that someone's going to do a study on berberine with dihydroberberine, right, together and see what has an effects on it. So you'd be waiting until kingdom come until that study gets done to figure out what's going to happen. So you may have to do some testing on yourself to see whether or not it's having a positive effect. Where'd I go? Maybe regulating R13 in some way. Not sure. I'm not sure what, I actually don't know what R13 is. Uracilin A, more. Sorry to go on. Yeah, that's a lot about uracilin A. We'll talk about it at some point. I mean, obviously I'm a mitochondriac, so I want to know about everything possible that can help improve our mitochondrial dynamics, as well as enhancing mitophagy for preventive medicine purposes. Hello from Morocco. Hello from Florida. So someone's talking about making a super yogurt with essential bacteria. I'm going to have a specific talk about probiotics and bacteria and its effects on lowering blood glucose. Because I was kind of blown away by how much of an effect it had on A1C. Vitamin D and melatonin pathway R13. I've not heard that come up, to be honest with you, Christopher, about vitamin D and melatonin's pathway R13. I mean, I don't know if you're talking about like specific antioxidant response elements. Both vitamin D and melatonin can upregulate Klotho and NRF2. I have to look into that. I'm not sure. All right, so I'm probably not gonna be able to hit sulforaphane today, just being very honest with you guys today, because we're already 48 minutes in and I haven't even started talking about cinnamon. So let's talk about cinnamon. So cinnamon, what I would say is most people know about cinnamon's effects on blood glucose, but I don't know if everybody knows about its profound effects on blood glucose that I was able to find when searching the literature. And as a matter of fact, when I went through functional medicine training, it was kind of minimized as being a folk remedy, but not having a lot of data behind it. And what I would say is I did go to, functional medicine training after 2015. It was actually like 2017, 2018. So these studies should have been out. So I don't know if they just didn't do a thorough literature search before making some of the claims they talked about, but I'll digress. So in this paper is titled The Glycemic Outcomes of Cinnamon, the Review of Experimental Evidence in Clinical Trials, published in 2015. And I'll be honest with you, I really wanted this paper because of the graphic, more so than anything else. The insulin receptor autophosphorylation and dephosphorylation, glucose transporter 4, receptor synthesis and translocation, modulation of hepatic glucose metabolism through changes in pyruvate kinase, and phosphophenol pyruvate carboxykinase, PEPCK, altering expression of PPAR gamma and inhibition of intestinal glucosidase are just some of the mechanisms responsible for improving glycemic control with cinnamon therapy. This particular paper looked at 8 clinical trials of a cinnamon extract ranging from 500 milligrams per day all the way up to 6,000 milligrams per day. Wow. And for a duration of 40 days to 4 months. And they looked at, the effects on A1C, blood glucose, et cetera. So a wide range. See, this is what I'm saying. And this is basically kind of like a meta-analysis of clinical trials, right? They looked at everything from 500 milligrams up to 6 grams, and they only looked at 8 trials, right, at that time. So, how can you really look at apples to apples and oranges to oranges, vice versa? I'll digress. So I really wanted this graphic. So cinnamon having effects on white adipose tissue, WAT, on the liver, creating multiple chemical cascades that decrease insulin resistance. Is also going to have effects on delaying gastric emptying, which is going to allow for better function of the pancreas and inhibiting pancreatic amylase. That's very interesting. Inhibits amylase. We've seen glucose, alpha glucosidase, but we have not seen anybody or any of the compounds inhibiting pancreatic amylase. Amylase breaks down starches into glucose molecules so they can be absorbed by the small intestine. Then later on, it actually inhibits glucosidase as well in the small intestine, similar to that of berberine, which ultimately leads to lower blood glucose because it's not getting into the system, right? And then in addition to that, it's going to actually enhance insulin receptor function, basically, by phosphorylation. It's going to have effects on enzymes that are responsible for the hepatic glucose metabolism, specifically this PK and PEPCK, which is going to increase glycogen synthesis. And it's going to have effects on upregulating glucose transporters, similar to that of several compounds we looked at, GLUT4, as a way to lower blood glucose. So again, these compounds don't have just one mechanism of action, right? It's not just like an Ozempic, which has one specific mechanism, but it does it very strongly. These have what they call pleiotropic effects. They have multiple effects and affect from a more kind of holistic way. This paper was later published in 2021, titled "Beneficial Effects of Cinnamon and Its Extracts on the Management of Cardiovascular Diseases and Diabetes." And it says here that cinnamon has been an eminent component of spice and traditional Chinese medicine for thousands of years. Just think about that. We've known about cinnamon's effects on these diseases in traditional Chinese medicine for thousands of years. So this is not a new kid on the block, right? We've known about this for a long, long time. Furthermore, emerging evidence has established that cinnamon improves diabetes, a crucial risk factor for cardiovascular diseases, by enhancing insulin sensitivity, insulin secretion, regulating the enzyme activity involved in glucose, regulating glucose metabolism in the liver, adipose tissue, fat tissue, and muscle, ameliorating oxidative stress and inflammation to protect the islet cells or the beta cells in the pancreas, and improving diabetic complications. So this graphic is also pretty cool because as we look at various organ systems that are responsible for the kind of setup, right, for metabolic syndrome, diabetes, etc., hyperglycemia, we see it has effects on insulin-like growth factors, PPAR gammas, insulin receptors, etc., in the liver. It's going to have effects on the glucose transporters and glucose storage in fat cells as well as muscle cells. But then in muscle cells, it's going to help lower advanced glycation end products. Remember, those are when sugar attaches itself to something and damages it, right? It's going to have effects on inflammatory cytokines, lowering them, as well as upregulating protective things like NRF2, which is the main antioxidant response syndrome or system, which is why catalase, superoxide dismutase, glutathione are going to be increased within muscle cells. Again, lowering TNF alpha. Now, the question I would have, because you're going to see several places where it upregulates endogenous antioxidant systems such as glutathione. So my question would be, is this good for metabolic therapy because it's upregulating glutathione? I think the jury is probably still out. I have not studied cinnamon as it pertains to enhancing metabolic therapy from a perspective of lowering glutamine availability or cysteine availability. I have not seen it come up when it comes to be talking about enhancing ferroptosis within cancer. So the jury's still out from that side of it. But by lowering blood glucose and by lowering cancer's availability of having glucose, so therefore it can't participate in the Warburg metabolism. And then an offshoot of glucose, of course, is the PPP or the pentose phosphate pathway, which is going to be responsible for several things. But one of the things that it's responsible for is recycling glutathione. I would say that it's either going to have a neutral effect or even a net positive effect for metabolic therapy, but I'll digress. It's going to have protective effects within the pancreatic beta cells, like it talks about, of lowering inflammation, oxidative stress. It's going to have effects on alpha amylase, alpha glucosidase, and several other key enzymes of actually absorbing glucose within the intestine. And it's going to have effects at modulating the gut microbiome or the gut microbiota, specifically in lowering this particular Lactobacillus johnsoni, which I don't have expertise in the gut microbiome and knowing what every single, Lactobacillus or bifidobacterium or Clostridial bacteria does when looked at. But they do have associations between certain bacterial strains, and if they're high, for example, if I order a GIFX comprehensive from Genova, which is my preferred test I look at, the gut microbiome, it will have part of the report, which is really helpful for a clinician like myself. It will have, okay, if Akkermansia is low, it's associated with this, or if Akkermansia is high or sufficient, it'll have effects on this. And it'll break it down by certain bacteria. And that list keeps getting longer and longer as we get more information about the gut microbiome and what different kind of colonies or strands will do. Well, in this case, it's going to modulate this particular bacteria, this particular lactobacillus, which could have a positive effect on basically metabolic syndrome as a whole, as well as diabetes. So what happens when we actually look at cinnamon and its effects on blood glucose? So this was a meta-analysis that was published in 2023. And I'll say that, meta-analyses are not perfect. There can still be problems with meta-analyses. And, I'd have to really look at the meta-analysis here of why this one that was published in 2023 is so much different than the one that was published in 2024. I have my own bias going into this, thinking that, okay, this journal here and the authors here may have been looking to bring cinnamon down a notch by trying to make it seem like it's not as impressive. Because when you look at the actual hemoglobin A1C changes here in this meta-analysis, it shows that the A1C only dropped by 0.1%, which is not a crazy amount, which is not really, significant, but it's not enough to write home about, right? It's not like, oh my God, I got to run out and get some cinnamon right now because it's going to be life-changing, right? But in a meta-analysis in this phytotherapy research, which just by the name of the title, it makes me believe that they're more open to using natural alternatives. So that could be a problem too. But let's just say hypothetically, it means that they're going to be more open-minded and they're going to do a better job when selecting studies and looking at a systemic, review and meta-analysis. Then in this particular paper that was published in January of 2024, it looked at 24 randomized controlled trials compared to 11 back here. And it showed that there was an average blood glucose or an average A1C lowering of nearly 0.7%, 0.67%, significantly higher, right? That's actually better than Berberine, right? 0.67% in a meta-analysis, a recent meta-analysis is actually higher than the one we found for Berberine, because Berberine in this meta-analysis in 2024 was 0.5, or was it 0.57%, right? So cinnamon, at least at the most recent data, okay, and in a meta-analysis and systemic review, cinnamon is actually more powerful at lowering blood glucose and A1C than Berberine. So I thought that was very surprising because, again, when I was going through functional medicine training, it made it seem like cinnamon was kind of like, it's a folk remedy. We've been using it for a long time. People believe that it can help, but in reality, it doesn't help that much. And when it's studied, though, even the most recent up-to-date studies show that it's actually probably as effective as metformin, if not, and it's definitely probably more effective than Berberine, slightly more effective than Berberine. So I just wanted to share that. This is some of the mechanisms of how cinnamon works. Again, it's going to have effects on upregulating glucose transporters such as GLUT4. It's going to have effects on increasing if the effectiveness, not necessarily the number like Berberine. Remember, Berberine actually upregulated the amount of the insulin receptors, what cinnamon is actually doing is actually having an effect at the some of the chemical machinery such as phosphorylation and dephosphorylation of the insulin receptor that allows it to function better, right? So the ones that we have function better. So what I would say is there's probably a very high degree of synergy, although I haven't seen it in the study between berberine and cinnamon together, right? Berberine and cinnamon together can have likely a very powerful synergistic effect at improving glycemic control. So I was going to try to cover sulforaphane in this particular session, but we're already an hour in, and I just want to say that I think that we probably should cut it off for today. We've hit two major phytochemical or nutrients in the fight against high blood glucose diabetes, and in the fight against trying to get our blood glucose down so we can employ metabolic therapy in a way that makes sense. Let's see here. Do you think that at some point you'll go over the possibility of hydrogen monotherapy? So this is my overall gestalt on hydrogen monotherapy. I don't see how yet, from what I've seen, how it is going to dovetail into metabolic therapy yet. Okay, doesn't mean it's not effective. Doesn't mean it's not good. Doesn't mean it's not going to. It's just kind of like ivermectin. Like I haven't seen how it dovetails into metabolic therapy yet. And when I look through anything I'm looking at, any intervention, I'm like, how does this enhance metabolic therapy, right? Because we know that cancer cells are going to rely on glucose and glutamine, and they're going to need that for energy, but they're going to need that to redox homeostasis as well, right? And so I'm like, how can we tip the scales in our favor to enhance metabolic therapy as has been laid out by Dr. Seifried et al. And colleagues, right? So I have not seen how that could be affecting it. That being said, one of my mentors, who I respect highly, Dr. Jack Cruz, is not a huge fan of hydrogen machines unless the caveat is that if you're using a hydrogen machine, let's say I've seen ones that use water, make sure you use deuterium depleted water in that machine, because the issue is, what is the fractionation of deuterium in that hydrogen making machine? If it's going to be 150 parts per million or more, then it's going to probably do more harm than good. If you're looking at hydrogen that is very highly, protons, not a heavy deuterium content, it's probably going to have more of an effect. But I do need to study it more before I'm willing to go there. But I want to do everything possible. There are no doors for me that are shut in terms of figuring out ways that can help people get better. Watching from Seychelles. Where is Seychelles? I'm sure I'm mispronouncing it. It sounds maybe French or something. I'm not sure. As you can see, I'm not a geographer. Polyphenols seem to be the common factor. Man, polyphenols and these chemical compounds are unbelievable, both for preventive medicine, but also for treatment. I agree. That's why I can't get on board completely with the carnivore thing. Not that I don't think that there's like benefits of being, on a carnivore diet. You're missing out on a lot of these phytochemicals, and I think you're throwing the baby out with the bathwater. I kind of like the approach more that like Dr. Gundry takes, where like you're like removing things like plant compounds that have a lot of lectins and a lot of problems, pro-inflammatory. I haven't really gone down the rabbit hole of the oxalates and stuff like that as much as I would like to, but then again, you're missing out on so many different phytochemicals. Was on the edge of my seat? Really? It can't be that. It can't be that exciting, can it? I'm trying a few things on my 12-year-old dog. She has a big hemangiosarcoma. Man, I'm so sorry to hear about your dog. If my dogs were sick, you best believe they'd be on metabolic therapy and a whole host of things. I make matcha chai latte with cinnamon and turmeric with allulose as a sweetener. So you got EGCG, you got cinnamon, you got turmeric, curcumin. Wow, that's a great combination. How does it taste though? Because I love matcha and I love cinnamon and turmeric both, but combined, it seems like it may throw the taste a little bit. Just so you know, appreciate all what you do to enhance health outcome, our health. You're very welcome, Donna. I just want people to be well. If I could put myself out of a job as a doctor and go like be a smoothie chef or something like that, I'd be happy with that. Green tea extract in my yogurt, carnivore. Thank you for these streams. I'm carnivore modified by my yogurt. Yes, that's that enthralling. Well, hey, if it's that enthralling for you, that means either the information's good, the presentation's good, or you're just really, really boring. Just kidding. I've been carnivore for 9 months of 51. Near Madagascar. Wow, that's a long ways. So it's just unbelievable that that here in Fort Lauderdale, Miami, Florida, we're reaching people near Madagascar. It's pretty unbelievable. But then again, I have people from China and from the Middle East and from India and from Australia. So it's pretty cool. All three. Get funny. All right. Well, if you like videos like this, and they are enthralling and they keep you on the edge of your seat, please like it, share it, subscribe. And until next time, and we will try to cover sulforaphane. We'll try to cover simulaurin or milk thistle and resveratrol. But just believe it or not, we're not done after that. We still got a lot of stuff. We got probiotics. We got short chain fatty acids. We've got deuterium depletion water. We've got all kinds of other stuff that we can do to lower our blood glucose that are going to be coming in the coming weeks. And this week I'm probably going to be able to do one live stream, but I wanted to make it a good one. So hopefully the berberine cinnamon combo 1-2 punch was a good one. And until next time.